about how we do presentations, how we present AMBOSS, and so that she learns a bit more. So don't wonder, she is on board here at this call as well. So hello, Quinn. Great to have you here on board.
Hi.
Otherwise, very warm welcome to this webinar or this workshop where we talk a bit more about AMBOSS. What I want to do today is I want to give you a little bit about background on AMBOSS. What is the philosophy? What is the idea behind it? And want to show you how it works. And of course, then a third point is to show you how this can work in teaching. And this is something, we think will take maybe like 30 minutes, and you're very welcome to ask your questions. I'm happy to stop in between. So if you have a question, please just let me know, and then we can stop the tour and work a little bit on that. So having said that, just give me a second, please. Maybe Quinn, may I ask you to have a look on the chat box? So if there are any questions, then later you can help me to track this information. So then I will share my screen with you. I would like to start with a short presentation. So you now should be able to see my screen. Arrange everything, and then we can start having a look at this. So what I want to show you, I want to tell you a little bit more in the first step about what is AMBOSS, what is our philosophy, where we are coming from. And I would like to start with this picture. It's not nicest, but it's definitely like a very nice one. You meet here our three co-founders. This is Majid, this is Sievert, and this is Kenan. And they studied together. And after graduation, they thought there must be a bit better way, a bit more effective way to study medicine. So they had like tons of books and paper and PDFs and whatever was flowing around. And it was very difficult to keep track of the studies, to actually come up with a tool which helps you to keep track what you're doing, but gives you a good feeling about what you're doing, that you are sure that you didn't miss any important information, for instance. So they came up in 2012 with AMBOSS for the German market. So it was back then all in German. And we had then a lot of students, especially from the United States, who just approached us and told us like, hey, we really like this idea and we would like to have this in English as well. And so we investigated what we could do, and we came up then with an English platform, which is now available for the preclinical and the clinical years as a complete package. And this is what I want to show you today. Here you have a quick overview about what AMBOSS could be, or what their solution and their invention means. We have over 1,000 or almost 1,000 articles that way. Almost 1,000 articles, and you find all the preclinical and the clinical knowledge there. We have 20,000, and I think much more now, searchable medical terms. So it works like Google. You can just like key in a search term and it will suggest you possible solutions. And this is something I will show you later as well. We have over 200,000 crosslinks, which is very interesting if you want to follow a specific topic. Let's say you want to continue reading or you discover a knowledge gap. Then you could just click on the next link and you forward it to the next part of the platform. That's something which is included. And we are nowadays, Eka, when we met last year on the conference, then we were at, I think like 4,300 clinical cases in our question bank. Now we are at 5,032, if I'm not mistaken. This is the latest number. So clinical cases, which are on our platform, which help students to, strengthen their diagnostic skills, to train medical concepts, and of course helps you as mock-up cases, for instance, in your teaching. And what we want to achieve, so we have a knowledge library, we have an analytics tool. This is something I haven't mentioned yet. So an analytics tool for the student primarily at the moment. And we have a question bank. And all these things should work together. And you can jump from each part of the platform to the other. And you can easily address the knowledge gap. For instance, I am in a question bank and I struggle with a question. I can go back to the library, can read up information very easily. And I get analytics, which help me then to keep track of what I'm doing, my performance, and give me suggestions where to continue to study. And this here is a link or a quote from a student, and unfortunately it's an anonymous one, but I really, really like it. That's why I put it here on the slide. AMBOSS-is like up-to-date, Anki and Osmosis had a baby and Wikipedia raised it. Yeah, basically, this is what I want to show you now. And this means I would switch to our platform. First of all, you see here a screenshot of our homepage. In case that you don't have an account yet, it's very easy. You click here on the free trial, and then you can start your personal account. And then later on, you can add the campus license to your account. It's no problem. So just in case you want to get started right now, very soon, then you could do this that way. Having said that, I would go over to our platform. You should now see my dashboard here. I get an overview where I'm standing. So you can see I'm a terrible student. Those who met me last year will see I'm improved a little bit, but not too much. So I need to work and keep on working a bit. And I see here what I did recently on the question bank. And of course, in the knowledge library, the articles I was reading, I can find them here. On the left-hand side, we do have a menu, and you will find all tools here at one spot. We have the library, the question bank, the analysis, all these three pillars. The rest I will share later a bit about. Let's have a look into the library. We do have articles or chapters, and they are structured in a chapter tree. So let's say we are in basic sciences, we go by system, and let's say let me quickly see, the respiratory system, for instance, and I would like to learn something about airways and lungs. This is one way I could find a topic I would like to work on. There is another option. I can just go here to the search bar, and here we are at something which looks almost like, or might remind you of Google. Let's take a quick look here. I would like to show you the knee joint. I think this is a really nice chapter because we have like a lot of nice tools there combined. So you see here, I have key in my search term, and you will get here a list of topics related to my search term. This is not only an article, this could be sections or parts of an article which are related to it. And up here we do have, you can see already a lot of resources. I will maybe jump into this chapter by clicking on it. And you see I'm right at the exact spot what I was looking for. I will go to the top. You can see here we have a table of contents. Here on the left-hand side, you can click on the summary button. And then we start with the summary. We have here a little abstract, which gives you an idea of what you're going to learn here in this specific chapter. I will expand the entire chapter for you, and then you can see already, if I scroll down a little bit, everything is about being short, being concise, and being simple. So this means we put everything in bullet points. And if you need more information, you can see you can hover over those dotted lines, and then you get more information, but only if you need it. If you don't need it, then we don't want to add or add too much information here at a point and distract students from actually what they want to learn. And you notice that here is some part underlined or highlighted in red. This is one of the beautiful tools I really like about the platform. This is called the Learning Radar. And the Learning Radar helps me to, or reminds me that I was answering a question related to this specific information wrong in the past. So I should pay special attention to this part. So whenever I come across, I will be reminded until I answered this question correct. So we can go quickly through it. I give you an overview how such a chapter looks like. We are here in a basic science part. So you would find here, of course, like a lot of interesting material, which should help students, of course, to understand the topic better. We have an illustrations team, which is medical illustrator who are specialized on creating our content and make it hopefully more fun for the students to review it. We do have a lot of tables on board, and tables is a friend of mine. You see already, I started this as a quiz. So the bread and butter business of students. It's very easy to compare information, to have a good contrast. And here you can find all this information presented in tables. We have this across the entire platform. And like you saw already, you can turn this into a quiz. And you can click on each of these boxes and you can hide or unhide the content. So you can actually learn and study better and train your knowledge or see whether you could memorize everything correctly. A lot of our illustrations come with a quiz function, so which is very nice. So if you want to train this one, you can turn off the indicators, the labels. Of course, both of them would be possible. And then you can turn this whole thing into a quiz. And I think this is an additional layer of interactivity, which is quite nice for students. You see, I was wrong, but I get, of course, like the correct information. And then I could continue finishing this quiz. I think this is a nice additional feature for our platform. Let me scroll down a little bit more. I would leave you can explore this in detail later on. What I would like to show you as well is a bit more of data. We have a new cooperation, and now I just need to see where it is. There we go. I jumped to the knee joint. We do have 3D models available now on our platform, which is a very nice tool. So if you imagine you are on a Zoom call with your students and you would like to demonstrate something, you either record it or you show it live on screen, you can have, or you can use those videos to demonstrate a specific information. What you also can do is you can rely on that AMBOSS is providing this additional layer of support to your students. So if you say we are in a class and you would like them to review specific information, you could use, of course, the AMBOSS chapter as well. I will start this video quickly. I think the sound is not so important, so I just don't leave it. So you see it's a video, but I can pause it at any point in time. And then you can see, I can turn it around. I can then highlight specific parts, and I can, of course, then jump to the next section. So it helps me to explore what I'm seeing much better. So I think it's a wonderful tool, and I'm sure your students will like it. So this is one option, what you could see here on our platform. And down here, we have the references. So what we have used here to create this article will be all referenced down here. So you can be sure that you could either review the resources we have used, and you can be sure that everything has a scientific foundation. So you would find for each section, the respective articles included here and highlighted so far. So now we have had a look into a basic science topic. I would jump maybe now to a clinical science topic, and I would maybe take something, it's almost like a blockbuster at the moment, and I would go for pneumonia. You see here again, we do have here like related topics. It helps me also maybe to discover things I might need to know, so it expands my, my understanding of the context. And of course, here is the media included. Then I click on the article. This is the top result because this is a dedicated article on pneumonia. Turn off the learning radar maybe for the moment. And I expand then the sections. You see we have an introduction or a summary again. We do have included in many, many chapters osmosis videos because students really love those explanatory videos. They are really, they're really good. And this is something we can't do better. It's fantastic. And that's why we include them here on our platform. Again, we have here the tables included. And then you find here on the left-hand side, again, the table of contents. We have everything here included, including the diagnostics, the treatment. This is all here at one spot in one article. So we can have a quick look, and I scroll down a little bit that you get an impression. Again, here, everything is meant to be short and being as concise as possible. I can leave a note if I want, for instance, since you highlight specific information in your class, I could leave myself here a note, and this would be just for me, and I can review this anytime in the future if I'm preparing for an exam. If I come across this information here, I can always review it. AMBOSS is working like almost a true microscope. So I just want to show you this feature as well. It's called a smart zoom. We have an overlay, which is showing you general aspects, but the smart zoom is, I think, the truly exciting part of it. So you can see we just need to zoom in a little bit more. Just need to be a bit, there we go. So you see the quality is fantastic of these slides. You can click on the dots and you will get additional information. So which then highlights the information here or what you can see here. So AMBOSS works in this case almost like a tutor, which is just standing beside the students and tell them like, hey, look at this specific part of the slide, or look at this specific part of an X-ray. Just have a look and just try to identify the problem. So this is what AMBOSS would help you or help students effectively on. So we can have a quick look on the diagnostics. I would like to show you some of our X-rays. So we have across the entire platform, thousands, I think, of X-rays, of CT scans, sonographies. So this is all included on the platform. And here as well, we do have the overlay feature. So you see, if I click on overlay, we have an additional layer of information, which helps students here again, points out what is really important to know, to understand, to identify, so that they can make the right diagnosis to be able to read such a picture. So if you think about, like, for you as a teacher, then you could also use this, of course, in your presentation, either in a Zoom call or, of course, in a PowerPoint slide as well. As long as you don't publish it, we are perfectly fine if you just use it in your presentation and reference it to AMBOSS. This should be fine. So this is what AMBOSS could do for you on side of the knowledge. So I could find a lot of relevant information here, basically all the relevant knowledge, but now I should think about how to train this knowledge. I go back to the top, and I do find up here a button, question bank session. I click on this button and I get some more information. You see here, my study goal is set as general studies. You can change your study goal effectively to any subject or to a step exam. So this is not a problem. I choose general studies because it's actually convenient to show things to you. So to demonstrate, I think that's the best option. I'll show you later why this is the case. So I can decide whether I worked on this question before, whether I used help, or whether I answered it incorrectly or correctly. And then, of course, I can determine how many questions I would see. Let's say we want to see 20 questions. We click on Start, and we are automatically forwarded to the question bank. So we have here the case of a 69-year-old man. And yeah, he's brought to the emergency department. We know that he has cancer. And now we need to start making a diagnosis. it's a multiple choice answer setting. So we have a clinical case up here, supporting information, and down here, multiple choice answer options. Let's start with having a look on the case. Let's say a student wants to make sense out of it or wants to find a way individually. Without your help, you're not around, you can't discuss with them what they're gonna see or can't help them. So the student can decide, can go through the information provided, can highlight specific things like maybe the temperature or the pulse are important. And so you could go through the entire question and then think about what could be right. If I'm not feeling sure, then down here, there's a little item, it's called key information. And this is meant to, you see, I was actually wrong with my idea, like in the temperature and the pulse were not really relevant. My colleagues from the editorial team highlighted here in green what is really essential to know, the information you have to catch if you want to answer this question correctly. So now I could try to answer this question. And see here I have several options. And let's say I could say that I do know already that A is maybe not relevant and C maybe not. So we are looking for a pharmacotherapy. So I ruled out those one as an example. And now I could decide for an answer. So you see, I choose the wrong answer, but I get an instant explanation why this has been, why this is not the correct idea. It doesn't need to be wrong, but it's not necessarily in this situation the correct answer. And you see here we have, if you hover over the dotted lines, again, additional information if you need it. So a definition, and then of course down here a link to the next chapter in our knowledge library. You might notice that I can still continue answering this question. So most question banks actually expanding everything. So you hit the wrong answer button and then suddenly all is shown, even the correct answer, the wrong answers, everything is shown. Here I have the chance for a second or a third attempt and just try to understand what could be the right diagnosis or the right treatment in this case. You see, I have a second and a third choice. Maybe now I should show the answer because I'm apparently not able to answer this question. And you see here, this is the correct question. And a feature I personally like very much, you click on the link. Sorry. And right side by side, you have the question and you have the knowledge library. So highlighted in green, you can see here in this table, the information I was supposed to know to answer this question correctly. And you remember we came from a chapter on pneumonia. And we see that this question is also related to an entire different, or not different, but a related topic. So in our question bank, we not simply do a knowledge quiz where you can just say like, ah, okay, I know this, I can memorize this. We want to challenge students to come up with a diagnosis to improve their clinical reasoning skills. And so this is why our cases are challenging, but I think they will help them to grasp a greater context of the topic they're studying. Let's take one more look on another one. So we do have here a next case. And again, we would have here the answer options. We do have here the key information. We have the attending tip. This is an additional layer of help where students can get some hints towards the right answer. This little doctor here is not revealing the correct answer, but giving them some pointers, what could be important to consider to make this diagnosis, to actually improve the diagnostic skills. And so then they can continue answering the question. Finally, we can take a quick look on my study summary or on my last lessons. So we start with the overall study summary. So you have here a general overview. I just scroll this down a little bit that you can see it better. My latest answer attempts, or of course, my overall answer attempts. I have a peer group comparison. You see that I'm a terrible student, but maybe eventually if I'm training harder, then I would be, of course, like here in this strata. And here I can see like the red part is incorrect answers, the yellow part is correct, answered with help, and the green one is answered correctly in the first attempt. And down here, based on my performance, the system now suggests me where to continue to study. So in my case, you remember, I decided for general studies as my study objective, and AMBOSS, the platform, is then suggesting me topics which might be relevant for me to continue to study. Epidemiology is one of those. You see, I did already quite a number of questions in our question bank. Not so successful, so I can continue straight away by clicking here on the QBank button, or I click on the library button, and then I will be automatically forwarded to our knowledge library again, and then I can continue reading. So this is basically like the three parts of AMBOSS which are coming together and helping students to address their knowledge gaps, to expand their understanding of greater contexts. And so since you have all the preclinical and clinical knowledge here in one spot, it will help students a lot to actually independently follow up or understand greater contexts better. I would take a short stop here at this point and have a quick look. Do we have any questions so far? So if you like to ask a question, you can just unmute yourself. You find this little icon in the control panel below. Otherwise, you're very welcome to use the chat box, which is in the control panel as well. Otherwise, if there are no immediate questions, then I would continue with and switch back to my presentation. So I hope you can still see my screen. I see there is in the chat box a question coming in. All right. So we now have completed our tour from the platform. So I showed you how AMBOSS worked, and now I would like to show you how AMBOSS could support you in teaching as well. So I mentioned already quite a number of features which could help you to design your classes, to enrich your classes especially. So if you think about all the media we provide, we have videos or even study plans you could use and share with your students, and you can use them as an add-on to your teaching. I will show you later how this works. You can share it very easy. You can leave it in your learning management system. You can share it by email and so on. So this is all possible. Then, of course, you could use AMBOSS to integrate for an integrated teaching approach. So where you mix face-to-face sessions or completely online classes. And of course, you could completely virtualize things if you use AMBOSS as, let's say, a digital course book. And on the same time, the questions as an assessment tool. If you want to go fully digital, this would be a possibility we could support. So here's a little overview, which makes it a bit easier to share about how AMBOSS could actually support you in teaching. So let's say before the class, you can, of course, assign chapters or content from AMBOSS. Provide this to the students, to your students, and say, please read up this information, or please work on this clinical case and try to answer this so that you are ready for the topic you're talking in class or in a call like this, or in a setting like this right now, then you could have used, of course, use AMBOSS as well. So you saw already it's very easy to search for information, and it's very, very easy to jump from one part of the platform to the other one due to the crosslinks. So let's say you are in a setting where students are working in small teams, and you work on their problem-based learning skills, for instance. Problem-based learning means you have the case, you all know that, challenge them to find the correct diagnosis, the correct solution. So you would then be able to, students would be able to just follow up on information, would try to research information, and they would find in AMBOSS, of course, all the relevant knowledge they would need to answer this question, to make a diagnosis for the case. And of course, all of this is up to date, and this is something we are really proud of. We have over 70 medical doctors working currently for the content of our platform, and they are making sure that the content is always up to date, and of course then researched well, so that you can be sure that your students are actually like researching or using an always up-to-date resource for their class. And as a follow-up, AMBOSS often could help you after the class as well. So you could assign them, again, a case from the question bank, or you could assign them a chapter and tell them, like, please follow up. And of course, especially since we are in an online setting, many students will find it difficult to actually keep track of the classes, of the discussion. And so here we can, AMBOSS could help as a reference tool as well. So they have a companion which is helping them whenever they have a question, they can research this question, find a solution and answer. And that's something which gives them a bit more stability and a bit more security in the study and learning process. So, but now I have talked about that you can share content with your students. Now I want to show you how this actually could work. And it's very, very easy. So we have, as you can see here in this example, we have permanent links used for the entire chapter or article. And you see here the summary. You remember this was here on the left-hand side. And you could even copy the address to each of these subsections. So you can point out exactly what your students should study. And this is a very easy way. So link sharing is compatible with everything what you are using. May it be Moodle, or you could even forward it in a Signal group or whatever platform you're thinking of. A link of this will work all the time. And we make sure that this link is always working. So even if you use this, let's say you integrate this link into your learning management system, and we change something in future, then still the students will be able to access this information, the updated information, so you won't lost anything. So there is another option what you could do, and Caroline told me already that some of you already have access to the AMBOSS University sessions. So I want to give you a brief overview how this could work. In case that you don't have access yet, then you could you can contact Caroline, my colleague Caroline. She's managing your license, and she will be happy to help you getting onboarded to that. But for today, I want to give you a quick overview how this could work. So like I mentioned, we are at 5,000 and even more nowadays questions. You could use all those questions. I showed you 2 examples of those, and put them into a personal folder you can share with your students. Since we are, since my platform is still open, I would jump back to the platform and show you how this works in real life. I go to the question bank. I can here create my personal session. And you see here a lot of properties I can use to determine what kind of questions I want to see, to make sure that I have the most relevant clinical cases to work on. Like I mentioned, we do have exams included. We have symptoms included. So we had the example of pneumonia. Then maybe we go for something like chest pain. And in the systems for the respiratory system. So, and then you could also decide for a discipline. I would just leave this open maybe here for the moment. And I can decide on the difficulty of the question. You see, 1 hammer is very easy, 5-1 is very difficult. You might wonder why we choose the hammer as a symbol. In German, there is a word for it. It's for the final exams. It's called Hammer-Examen. It's a hammer exam. Hammer because it's really, really tough and difficult to prepare for it and to master it. So that's why we decided for the name AMBOSS, which is anvil in English. And so that's the relation with the hammer. You forge steel, you work very hard. And so that's why we decided for the little hammer symbol. But now you would like to decide how difficult it should be for your students. Let's say you take 2 or 3 hammers and then you click on done. Status, that's really important to talk about. Not yet answered is included here, but it could include, of course, all those questions I have worked on before, even those which were correctly. And this is here a question what we could do in general, all time attempts, or on my most recent question attempts. That's something up to you. You can try this. Here, again, I can determine the number. We have 171 cases now. That's maybe still a lot. We decide maybe for 10. And then we have 2 options to proceed forward. You see here, there is an exam mode, which looks exactly like a computerized exam. So if you want to train how to work effectively in this environment, then you can click on this. But for our purposes, the university sessions, I will proceed with the normal study mode. This is the one I have shown you before. So we have here again a clinical case, here supportive material with the fantastic overlay function. This is all included here. And if you think that this could be a good example for your class, then again, here you find a permanent link. So you could share this with your students, and they could, as an example, and you can just point the right correct question, point out the right question to them. Additionally, you can put this question into a folder. I click on this little folder icon. You saw this down here. And yeah, we started the search on respiratory system. Maybe we want to add this question to pulmonology. I have already created a folder on that. And you see, you can either key in the title, whatever title you would like to do. It could be a semester, it could be a course, it could be a subject, and then you leave this here. So in this case, I already have a folder for it. I click on this little plus. It turns to an X, and this question has been added to my folder. And then, of course, I can go to the next one. Maybe this one is not so relevant, but maybe the next one is relevant for me and it's interesting. So then again, I click on the folder and the folder icon, and then I can add it. So for instance, to my test folder. How would this look like now? Here in the control panel, expand it again, under QBank, as a lecturer, you should find here manage university sessions. And this is exactly where you need to get a special permission. So that's why I would like to ask you to reach out to my colleague so that she can organize access for you, that you will see this item here. I click on it and I can go to a dashboard. And this dashboard shows me all my personal folders. And in these folders, there are the questions I have chosen before. So you see, I have a number of folders. I can add additional identifiers, which makes it easier to find them later. Let's say you have a number of question sets in the future. If you tick this little box here and the tick button, I can just do this right now. then your session has been published. Published means that the link down here is active. This means this is a permanent link as well, and you can send me, for instance, an email and say, Manuel, please complete this question session and work on this. So this is something you could share with your students as well if you want to point out specific questions to them. And that's it already. This is a very easy to use tool, and it helps you to actually work on the platform, point students out to the right information. We have also a little video on that, so I will share this later with you as a follow-up so that you can review this and yeah, explore this a little bit more and can press the pause button as well. So,
sorry, Manuel, can I ask a question?
Please.
Still about these cases, because I liked this, my university parts a lot.
Yeah.
So once we are sending this link to the students, can you show the interface, how the students are getting these questions, and then once they answer these questions, how we are getting feedback or correct or not correct questions? So how we can practically use, if we can practically use them as a quizzes.
Yeah. So the interface will look almost exactly what you would find here. I can show you quickly how it would look like. Of course, we have a test environment for our question session. And you would find here a list of what my colleagues have created in the past. And let's say we would have here, Caroline has created a folder on cardiology. I can click here on start, or I would click on the link you were sharing me. And you see, I'm just dropping into the question bank, but only seeing those questions you have selected for me. So that's something you can make sure that your students would see exactly what you're chosen for them. And the interface itself would remain the same.
So they can answer the question and it will in the same way show them whether it is correct or not correct. So my main point for my question is whether we can use this as a assessing tool, or this is just teaching tool.
Yeah, that's a very good question. Let me quickly switch my my screen, so then I can show you how this could look like if you would be interested in analytics here as well. And again, I will share my screen with you in a second. So. You should be able to see my screen again. And I have here a kind of data tool you could find in the back end of our system. So we do have here a demo session on family medicine. So you could, of course, decide for a certain date range. I just leave this open and you can see here the user activity over time. So remember, you have created your personal session, and let's say this would be family medicine. So, and then you would get specific analytics for this session. Then you have here an overview when questions have been answered. You can identify peaks. Here it's fairly distributed, and I think like somewhere here was an exam, you could tell. And but then this is the most important thing down here. All of these questions, which are in the question session at the moment, are reflected here in this graph. And what does it tell me? On the left-hand side, my students do not struggle with a lot. A lot of them are able to answer it correctly in the first attempt. A lot of them did it wrong here at this end. And I can review exactly the question which they were struggling with. So the next time you go to your class, you would maybe like to address exactly this part and would work on this one, right? And down here, we do have even per student, but this here is interesting, even per distractor. So you could see which answer option was the most popular. So if you feel that this is something your students, you can then see what was the most common mistake. This here is, of course, a lot of information. It might be easier to review this, for instance, in an Excel sheet or a Google document or something like this. That's possible. You can download this information and then you can analyze it and see how your students were performing in your question bank session. And you can have this for each of the sessions. You would find them all here in the drop-down menu and click on submit, and then you would switch to another session. So this would require to have like a meaningful name or a good way to find them or find information again.
So if I understood correctly, these analytics are telling me the average how my students are answering, not let's say student X answered correctly this and student Z answered correctly that one. So not according to the students, average analytics I'm getting.
Yeah. So this is based on a cohort. You would see the entire class, which is interacting with your session. You can have an add-on to this board where you can see the overall performance for each student, so that you can identify students who are weak or performing very well. Depends on, but I think like identifying weak students is maybe the most important issue. And this information is not standardized included or included as a standard because the European Union has very strict data protection laws. So this means like we need to have a kind of agreement or a kind of solution that your students, that we are allowed to share this information with you. Otherwise you could, we could see how the students perform, and this is something like we need to make sure that this is in place. Then we could also show you the overall performance of each individual students.
Okay, I understand. Thank you very much.
You're welcome. I saw that there are a number of other questions showing up. I just quickly have a look on our chat box. So there was a question on the image quiz and how this will work. This is something we could definitely have a look on it right now. The second question I see in the chat box is, and there's the question, I think, on recent updates. So which one has been recently added. I will jump back to the platform to answer those questions. So first of all, I will go back to the library to show you here an image quiz and how you could actually use this. I do know that we have one in airways and lungs. This is something, this was the wrong one. There we go. So again, we are back in the chapter. And you see, I was just keying in a search term, and then I could start working on this. So I think this one here, yeah. So what we do have here is the image, and here is the control panel. You can turn off on and off indicators and labels, or both of them. And then you can make it a quiz. And you see here the blinking line. This is what we are looking for. So unfortunately not the right answer, but then you could continue working on this and find the right answer option. So this is all you need to do. You go into our chapters. I have also a list of multimedia or illustrations which come with a quiz function. I will just have a look for it and share the link later. The second question was, I just leave the image quiz here. The second question, just a moment. So the second question was how to find information which has been recently added. So we go back, or we stay here on the article. That's actually a good idea. I go back to the top by clicking on the summary. And you see up here, there is a date when our editorial team made the last updates. First of all, I don't have a clear rule where I can tell you this is updated at this and this point in time. We have an editorial team which is really large. We are proud about this, and we create all this content you see here in-house, which means that we continuously go through journals or latest publications, review them, and maybe include them as well in our article. So what I could recommend you is, for instance, if you use one of our mobile apps for Android or iOS, then I would recommend to go online at least every 2 weeks so that you can catch the latest updates. So AMBOSS is updated pretty frequently. And this is an information you can find in the library as well. Let me quickly see whether I do find this right now from the top of my head. We do have a complete, let me quickly see, there we go. So you click here on either basic sciences, clinical knowledges or skills, and then you find here directly in the next level of the chapter 3, the content updates. It takes a while because this is actually quite a long list. It's sorted by months. So you can see here what we all did ever, and I expand all sections for the moment. And then you see here, including links or definitions, the topics we have updated in this month. So you can jump here, of course, here on the side through the chapters, and then you can review the latest updates. Here's an interesting point I want to show you. If you have a question regarding the content, let's say you have a feeling that you would describe the information different or deliver the information in this article differently, then you can leave us a message here, and my colleagues from the editorial team will come back to you in a few days and discuss with you whether something should be included, or maybe there is an aspect they should maybe include in the article. So we are able to have, we have this kind of peer review or peer conversation function in the platform, so that you can actually leave us a comment and can start a discussion with the editorial team without any problems, directly from the platform. I go one step back. We do have here as well a few more information, like the fact sheets, for instance. So I just pick out one example. So this also helps you to review, get a good overview, get a better understanding about what you're working on. And this is something we're currently expanding and increase this more and more. We have this for COVID-19, for instance. That's all here on the platform. So you could find this here and review this. We do have a second thing which might be interesting as well for your student, or just for you maybe to offer this as additional information, let's say, for instance, as a preparation for your class. We do have chalk talks included. So these are little interactive video lectures where you can learn a bit more about more complex issues. So this is constantly growing. So we have here a lot of these little interactive videos included, and they come with quiz functions as well, which is a very nice tool. So I recommend you, if you have the time, just explore it a little bit more, try to find if there is something which is interesting for you. This here is the study plans. That's something I found really important to mention as well. We have ready-made question packages, of course, according to the board exams, but also to subjects. And students can use those, of course, to prepare independently, but we have also courses on board. So let's say you would like to deploy our pediatrics course. This would be possible to use this as an additional layer of training for your students. For instance, we do have here like the learning cards assembled so that you don't have to choose anymore the right information. It's already here and you can just review it based here on this one. You can click on learned. That's some if you're done with it, and so it helps you to keep track of what you're doing. And there is a related question bank session, which helps you then to train this knowledge. Last but not least, I want to show you one part I personally like very much: the clinical skills. Most of you may know the term of AMBOSS-keys. That's maybe the most popular one. We do have here 40 cases at the moment, and we got really great feedback from students. They say like it's actually matching what they were asked in their exams. And you have here, we can take the abdominal pain as a starter, as an example. So you have here detailed instructions for the examinee and the examiner. So students are supposed to work in pairs or maybe in group. So you could do this, of course, like maybe not in person right now, but maybe online in a Zoom call, you could do this as well. So we do have constipation instructions. So that's included as well. We do have a checklist included, and this checklist allows you to see and keep track of what has been performed and was not. And of course, you see here as well, I will already hovering over the dotted lines, and then again, additional information is popping up. In addition to this, we do have a detailed demonstration how the examination is performed. So here again, we do have a little image which is demonstrating me the general approach to the examination. And then I would have here a video demonstrating it as well. So I can just start it quickly.
Murphy's sign. Ask the patient to exhale while palpating the gallbladder area medial to the midclavicular line.
So you see we have like here again the video, and then we have an overlay of additional information which helps me then to identify the right spot. And I will just maybe skip a bit further. Okay, now I'm going into YouTube, which is also then the next point I wanted to tell you. Up here, there's the link to the video. So if you want to share this with your students, you can do this straight away from here. But due to the time, I won't expand too much on it. Here's supporting information for the diagnosis. Here as well, this is now again a nice example for our overlay feature. So all this is waiting to be explored, and I hope you enjoy it. So you can just go to the library, the question bank, explore a little bit more how you like it and how it could help you actually in preparing your classes and providing them. So we'll have a quick look on the chat button. I think we don't have any further question in the chat. May I ask how it is from you? Is there any questions you would like to ask about the platform?
Okay, I don't have questions, but I have remark. I'm very envy for our students, because if I had this resource while I was studying in med school, probably I wouldn't struggle that much as I did.
Yeah, this is a wonderful thing, because this was actually the idea why we started AMBOSS, why this came into being. So otherwise it's very, very stressful if you want to cover everything, if you want to make sure, especially if you are in a curriculum which is focusing on final exams, which is in most countries the case. I think this is really, really, really a tremendous help. And yeah, thank you for the feedback. This is really encouraging. And I just saw like that someone else agrees apparently in the chat box. Yeah, thank you very much for this feedback. This is something we want to make the student's life easier, but also, of course, your life as well. So if you deploy AMBOSS for your students, and instead of a classic book or a PDF, you can share an article, and you can be sure that we do our best to make this the best information, the best standard. So you can rely on this. And like I mentioned, you can use it on your devices as well, your mobile devices. So there is an app for the questions and an app for the content. And both of them are interlinked, but we kept those separately because otherwise it's too heavy for the telephone. And but they are working perfectly together. And you could even review those things if you are, let's say, in a plane, or if you are in a place where there's no internet. It should happen in hospitals.
Yeah, actually, I think that's a very important information, especially for our students. And hopefully you will mention it tomorrow, because while they are offline, most of the time they can just very successfully use this time being offline and learn at the same time.
That's wonderful. I'm pretty sure that this is definitely part of it, and we will go through the entire platform in detail with them, explain, of course, their analytics part as well, how they can benefit from that. That's something my colleagues will focus on it. I think Tanner is doing it, and that's something I'm pretty sure he will mention this.
Thank you, Manuel. I was really infected by the AMBOSS after previous year, and seems that I'm widespreading the infection of AMBOSS at TMA level now. So thank you very much for helping me in this not easy condition.
It's my pleasure. And yeah, like I said, you're very welcome to reach out to us. This is something I haven't shared with you, and maybe I should quickly do this. I jump back to my presentation and just like show this quickly to you. So this is our email address, institutions@amboss.com. Of course, you can write Caroline directly as well, but she's a few days out of office. So please feel free to reach out at institutions@amboss.com. And we are very happy to support you with any questions you might have. And so my colleagues will be there, will be able to attend your questions if you need further support.
Thank you. Thank you very much.
So I have a look. There's a little feedback in the chat button that AMBOSS-is, yeah, facilitate a better integration between disciplines and the communication between the teachers. I hope so. This is something I'm really happy to do, and I hope we can support you there well. Like I said, if you're interested in the university sessions, please then reach out to my colleague Caroline, so that we can give you, based on the email address you use for your account, then to work on this. So this is included, so don't hesitate to do this.
And also I have just one remark. It was the question in Georgian from my colleague, Dr. Elza, how to share this content with students. Dr. Elza, students have the same access. That's why whenever you are introducing them to your groups that just they are able to use the AMBOSS, there is no problem. You will just give them instruction that they should use, show them what you are expecting from their level, and that's all.
Thank you. I will try my best.
Okay.
Thank you very much. So I think like I even don't have to be here. This was a wonderful explanation.
Yes.
Thank you, Manuel.
Thank you.
Additional questions, then like I said, you can always reach out by email to us. Otherwise, thank you very much for joining me today for the session. And yeah, I hope you enjoy working with AMBOSS, and
And thank you for you, especially because you interrupted your holidays because of this meeting. Thank you very much. We are really sorry, and please enjoy the rest of your vacation.
No worries. I can assure you, my vacations officially start tomorrow, so there's no problem. So yeah, wrapping up my work, and then I will head out to the holidays. And yeah, that's a fantastic end, actually, of a work week for me.
Thank you. Thank you very much, and let's be in touch.
Wonderful.
Yeah.
With this
Thank
said,
you.
I wish you a wonderful evening, and yeah, once again, thank you. Bye-bye.
Thank you.
Bye.
Bye.
Goodbye.
Bye-bye.
Bye.
Thank you.
Bye.